Good afternoon. Scapular dyskinesis. Scapular dyskinesis is one of the major problem in orthopedic conditions which is dwelling now. This is the scapula of human body. On either side of the scapula we have many more muscles. This is scapula which is surrounded by muscles all around this bone. Here medial side also rhomboids major and minor is covering, and upper trapezius and middle trapezius muscle is covering, and lower side also it is covered by lower trapezius and middle trapezius plus serratus anterior muscle, serratus inferior posterior muscle plus teres minor major muscles. All these muscles are covering inside. Plus inside this we have subscapularis muscles that is working to fix the scapula all along with the thoracic cage. It is going to fix the scapula completely on the surface of the thoracic. So all these muscles combinedly work together for the movement beneficial of the scapula. It should be so smooth and it should collide with the movement of the shoulder as well as the other structures nearby. So we call it as shoulder complex because this has to completely correlate with this scapula has to completely correlate with the glenohumeral joint here. For this we need the complete fluidity of movement in the scapula. The scapula is particularly having, this one is hiking of shoulder. For this, the scapula is moving upward. This one is dropping of shoulder. For this, the scapula is moving downward. This one is backward movement of the shoulder. For this, the scapula is moving back. It is called retraction of the scapula. Right? Then it is rounding of the anterior rounding of the shoulder. In this, the scapula is moving little bit anteriorly and coming out of the socket. This one is called outward movement. This is called protraction of the scapula. So for this, the scapula stability and proper mobility and fluidity is very important. For this, we need to strengthen the periscapular muscles on both the sides. Plus, we need to release and stretch and relax the subscapular muscles which is present inside the scapular region. So the proper lengthening and proper fluidity and proper strengthening of the scapular muscles is very essential for the fluidity of the scapula muscle, scapula bone. It should correlate with the movement of the shoulder. Now I am going to teach you 2 or 3 exercises, very simple exercises. These exercises will particularly concentrate on the muscles which you are speaking now. It will be helpful for your fluidity of the movement as well as the strength of the muscles which is surround the scapula. Exercise number 1. Keep your hands like this. You have to keep your hands like this in front, and you have to move your hands like this, sideways, like almost like opening the doors like this. Yes, and close together and come like this. When you are doing these exercises continuously, look at the scapula. It is coming for backwards retraction and it is going for protraction again and again. The muscles present in between these two scapula muscles, scapula bone, is actually going for little bit of squeezing that produces relaxation, as well as it is going for this kind of movements. It is producing isokinetic exercise for the muscles. When you are suppose adding up some TheraBand in front, here I am going to tie a TheraBand here with both the hands. It will produce extra resistance for the hand. That will produce more strengthening effect for the same muscles. Right? This is exercise number 1. Okay. Then exercise number 2. You have to keep your hands straight like this by the side of your body, and then ask the client to go for rotation of either side of the hands. Right? Can you do it? Yes. Can you come little bit back also? Yes. The hand should be moving freely and it should produce a large circle. So this kind of movement will produce a solitary movement over here, not too much, but anyway this will activate internally, this will activate the internal muscles of the scapula. Yes, can you do it like this? It should produce movement freely, free movement also, for that also. Yes, like this, very simple rotational movement. Okay, then this is second exercise. The third exercise, from the same position, ask the client to keep the hands on both the sides of the body towards the wall. It should be touching the wall, right? Keep the hands straight at the elbow level. Then your hand should be straight at the level of shoulder. Ask the client to move his body that means move his chest towards the wall. That means almost like he is trying to approximate the body towards the wall. Yes, can you do? Yes, and come back. Yes, can you do? And come back. Throughout this exercise, the client should not extend the elbow. It should be so straight. Yes. When he is doing the exercise, look at the scapula. The scapular muscles, the scapula is actually going for protraction and retraction. So the scapular muscles, the periscapular muscles are going for complete strengthening. One. As well as at the same time, the scapula is producing a fluid movement, a complete fluid movement inside. So the subscapularis is going for optimization. So this is the benefit of this muscle. Okay. In this position, exactly the head of the humerus will be exactly fitting over to the glenoid cavity. So all these three are beneficial to the shoulder complex. This is an excellent exercise for the strengthening as well as fluidity of the shoulder region. Good. Okay. Fine.